Welcome. Today I'll be discussing about the coronavirus, which is like a big hot topic in the news these days. And whenever there is like something big in the news, there is always a lot of false information out online. So I have had like a lot of my friends, everyone reaching out to me, what is this virus? How do we protect ourselves from it? And I'm hoping by making this video, I'll get some answers out there. So what is coronavirus? So coronavirus basically belongs to a family of viruses that routinely cause common cold in humans, and the family of coronavirus actually had like 6 viruses previously, 4 of which cause like regular common cold, and other 2, one is the SARS virus, which caused the 2002 and 2003 epidemic of respiratory illnesses in like Singapore, China, and those countries, and the 6th one is the MERS virus, which is the Middle Eastern Respiratory Syndrome virus, which caused the epidemic in Saudi Arabia in 2012. And now the 7th one in this family is the 2019 N coronavirus, which is the short form of neo coronavirus, which was first identified in December 2019 from China, and this is like the 7th virus in the family that is causing the current epidemic. So it was first identified in a small district called Wuhan in China, so it's also known as the Wuhan virus, in a seafood and a raw meat kind of market. So there were a couple of people who developed some common cold type of symptoms and then started having fevers with chest discomfort and shortness of breath. So they were hospitalized in China, and they found that they are having pneumonia. But when they tested them for the routine viruses and the bacteria that cause pneumonia, they all tested negative. So that led to further investigation, and they found this new strain of coronavirus called the Wuhan virus, or the 2019 N coronavirus. And before they could control the disease right in China, people travel from China all over the world. So now there are people diagnosed with coronavirus throughout the world. There is close to 4,500 confirmed cases all over the world in every country possible: Australia, United States, Japan, Nepal, Philippines. There has also been a case diagnosed in India recently, and it's from Kerala. And there has been a lot of deaths related to this disease as well, so that's why there is so much hype about this. So we saw what the coronavirus is, and I gave you some background. So what are the common symptoms if someone gets infected with this virus? It typically starts with a common cold type of symptoms, like some nasal congestion, nasal discharge with headaches, and maybe some cough. And when it goes to the stage of pneumonia, it causes like some chest discomfort and shortness of breath. So those are the common symptoms. There are other symptoms like nausea and some diarrhea being reported, but the respiratory symptoms are being consistently reported in all patients infected with this virus. So we saw some of the symptoms. So how does this virus get transmitted? So maybe the initial case they are thinking came from the exposure to the animal meat or the raw meat that was used in the market in China. But now it is confirmed that the virus does spread from person to person. And since it's a respiratory virus, the most common route of spread is like the respiratory secretion, like a person infected with coronavirus coughs or sneezes, and there's another person close to him, he gets exposed to the saliva or sputum of the infected person, then he can get the infection as well. So respiratory secretion, close contact is what they're thinking the route of spread of this virus is. But of course, we don't know if there are other modes of transmission as of yet. So we saw about the symptoms, we saw about what the virus is and what are some of the ways it gets transmitted. Let's see what is the treatment for this virus. First of all, there is no treatment as of now for this virus and the deadly disease that it's causing. So there is also no vaccine to protect ourselves from the disease. So all they're doing is, like, when a person is infected with this new coronavirus, they're just giving them supportive treatment, meaning like if they have fever, they treat that. If they have some shortness of breath, they treat that. And if their breathing gets really worse, they're being put on ventilators, and that's what we are doing now. And we are waiting for the virus to take its course, and hopefully the body's immune system would clear it, and some people are actually recovering from it. But as of now, there is no antiviral treatment that could kill this virus. So the key here is prevention. So how could you protect yourself from the disease is, since it's getting into a global epidemic now, avoid any unnecessary travel. And even if you have to travel, wear a simple mask. Wearing a mask would protect you from being exposed to respiratory secretions of someone who's having the virus and the infection. And if you're just going out to a crowded place or something, when you come back, wash your hands. The Center of Disease Prevention, CDC, recommends that you wash your hands with soap and water for at least 20 seconds. If you don't have access to soap and water, at least use a hand sanitizer. You have to use a hand sanitizer with at least 60% alcohol content to make sure that it kills most of the viruses and the bacteria. And if you're going outside and coming back, the surfaces you touch, it's better to clean them as well. And if you're going outside, don't use bare hands to touch your eyes, nose, or your mouth before you wash your hands. And the other things you could do is, like, if you know someone who's having symptoms like common cold kind of symptoms or shortness of breath, chest pain, with like breathing difficulties, if it's not a mandatory thing, don't visit them. And again, if you are sick, stay home and try to just go out if you're seeking medical care. And even if you have any of these symptoms, definitely inform your doctor and wear a mask when you go to the clinic so you protect other people from getting exposed to this. So these are some simple things that you can follow to prevent this global epidemic from getting even huge and like losing so many lives to it. Protect yourself and protect others. Stay safe. Thank you.